Mighty, mighty nurses.
Every day for the last 5 years we have worked short staffed every shift and overtime and can't take care of our patients' basic needs because there's just not enough of us to do it. And patients are not getting quality care. We don't want our patients to be hurt. We want them to get the care they're paying for, and we want to feel like we're doing the best job that we can do and should be doing. It's a very empowering experience and powerful to be with all of my co-workers and cronies here and M&A members. It makes us feel that we're not alone in our quest for all of this patient staffing stuff, that we're all in the same place, in the same boat, and it's really radical, and I love it. It appeals to my radical senses.
I'm here to support the nurses in terms of the staffing levels, and as a mayor, you want to advocate for the best interests of your constituents. And there's no question that having our hospitals staffed appropriately is important for the health and well-being of Duluthians and people from all over the area. So I think the cause is the right one, and the request is a fair one, and so I'm here to support. I'm hearing about the stories about the burden of being understaffed and not having enough nurse support when there is an emergency, when there is a situation in which requires a great deal of staff support to handle a situation appropriately. And it does come down to the health and safety, well-being of the patients and the people that visit the hospitals. Not to mention the health and well-being of the nurses. I've heard stories today of nurses one nurse trying to do the work of two people, whether it's lifting a patient or otherwise, and they're getting injured and hurt because of it. Duluth is a healthcare community, and so we are very well aware of the issues surrounding healthcare and the struggles and the burden that nurses are taking on as healthcare changes. Obviously, we're well aware of what happened down in the Twin Cities and those negotiations, and this is kind of now coming to Duluth. It seems as though from the outside that the issues are very much the same. It's a staffing issue, and having appropriate levels of nurse staff is important for the patients, and it's important for our community. Again, Duluth is a medical community. A lot of my friends from high school and college are nurses. They have a job that afforded them to stay in Duluth, and it's a city that they love. But they are feeling the effects of the understaffing and kind of the pressures and the changes in the healthcare industry in general. These are folks that love their community. They understand the importance of the work that they do, and they want to do it as best they can.